Welcome back to HealthWise. With us is Dr. Michael Felton, and we were talking about the low T or actually it could be high T if you're not taking the proper precautions and going to see a medical professional to test you and make sure. Well, Doc, what exactly, you know, I mean, some of the benefits, we were talking about obesity and how it's affected. What's some of the things with that?
Okay. Talking from the anti-aging or delaying aging, improving quality of life aspects of testosterone, if I can keep us in that right zone, in that right level of free, total, and the estradiol levels, then your risk of obesity is lessened. And why is that important? Well, the studies show that the belly fat that we get as we get older increases our insulin resistance, which increases circulating insulin, which accelerates atherosclerosis and hardening of the arteries, and accelerates coronary artery disease and peripheral vascular disease and kidney disease. And all these things which shorten and decrease your quality of life are directly related to not having a normal level of testosterone. We talked about ladies and why, you know, they used to think the reason men died younger is because of testosterone. It's not true. Ladies' testosterone levels remain fairly steady throughout their whole lives. There might be some fluctuations perimenopausally, but by and large their level. We unfortunately start out at a good level and drop off.
And that's a good point that you're bringing up, because a lot of ladies, a lot of people in general think ladies don't have testosterone.
Correct.
Only men have testosterone,
right.
But that's not true. And like you said, their levels stay even.
They stay fairly the same. The ladies who do have a decrease in their testosterone level will come to your office, will come in. I have ladies who are getting testosterone supplementation. In fact, and this shows you how old we are. Do you remember Estratest?
Estratest.
There it is.
Just say
See,
Estratest.
there was a drug geared for that. The problem was it was kind of the old, you know, close the eyes and throw a dart at the board and hope that those levels worked. They have to be tweaked so carefully that supplementation just wasn't really right. They got the boost in energy, they got the remineralization of the bone. This is ladies we're talking about.
Right.
They got the benefits to their bone and their energy and so on, but they had some of the virilizing effects of not properly balanced testosterone. And even though we're trained in it, there's not nearly the number of testosterone replacement studies in women as there are coming out this last decade for men. You know, the studies we're quoting, some of these things go back to 2001, right. Some from the 1990s, like 1999, that Russian study I was telling you about. But by and large, the research for ladies in testosterone is just maybe at a third of the intensity of the male hormone replacement stuff. Okay. So that's got to catch up.
Right.
You know, that's a failing on our part as scientists.
Well, and then, like you said, and they're doing a lot of the testing in Europe more. Their hands are freer, I guess.
Yes, sir. I would say so. Well, you know where my wife's
right.
from, so we spend a lot of time there. And again, I got into the training in anti-aging medicine connected to aesthetics through a European academy over there, and they helped facilitate my entry into the American Academy and my certification. And the professors there were fantastic people. They were very welcoming, even though I didn't speak good Italian. I speak very little Italian. They were very nice. I speak not much French, and they were very nice. So it was a good learning experience for me. It really took me out my comfort zone, but they crammed a ton of knowledge in my head over those 12 years. So I think I learned a lot of stuff.
Okay, so getting back to what you were saying about obesity, the belly fat, I think we all start getting that. I'm looking at
stop talking about it. What's the matter? You're supposed to be my friend.
But so you're saying that if you don't have enough testosterone,
yes, sir,
that leads to that? Or?
It actually predisposes you to belly fat. And you think, well, yeah, I'm older. I'm supposed to get a little spare tire. That spare tire is taking your life. It increases that insulin, that hyperinsulinemia. There's even a push now amongst the endocrinologists to reclassify diabetes, the hyperinsulinemia, as a vascular disease, because it is so aggressive at destroying the vessels of the body and causing the atherosclerosis and the damage to the cell wall, that it's more vascular than sugar related. So that endpoint of low testosterone can be full-blown metabolic syndrome. The hyperinsulinemia, the hypercholesterolemia. Remember, testosterone is bad for your cholesterol. No, it's not. It actually causes a good cholesterol profile if it's in the right zone. So it protects you from your sugars. It protects you from high cholesterol. It stops, literally, physically interferes with that 5-lipoxygenase enzyme to help break up that the arachidonic acid pathway that causes inflammatory leukotrienes to be released.
So basically what you're saying is, it's it's almost imperative that men get tested.
Yeah.
I mean, it's not just if they're having some kind of sexual dysfunction, yes, or ED, or just, but it's not a bad idea to get tested when you get to be a certain age.
Yes, sir. And you're talking about, you know, preservation of life. No coronary artery disease related to atherosclerotic things that are related to cholesterol, to the cholesterol management from testosterone. The inhibition or the decrease of your risk of developing full-blown diabetes. The prevention of the progression into that full-blown metabolic syndrome. Now here's the fun part. Forget the sex drive. What about you and I going to work and being able to multitask just like we did when we were 25 in school? You remember you could study, flirt with that beautiful lady you're married to, and all these other things, and keep it all in your head, not lose it. Testosterone helps protect the neurons of the brain. And this is, you know, there's chunks and just piles of data that shows it is a great hormone in the proper level for preservation of quality of life on multiple different levels. Not just cholesterol, not just sex drive, not just concentration. It improves depression in men. So having that testosterone level in the right zone helps block that chronic depression that you see in older men. I'm down, I can't do what I used to do, which makes me feel down more. I can't think like I used to do, which makes me feel down more. Wait a minute, 72-year-old, Pop, let's get you corrected. 3 months in the right zone. Dad, where are you going? I'm going to church, man. Then we're going fishing, then we're going doing this, and all that vitality returns, all related to management of that testosterone level.
Wow. Well, and so that, like I said, that shows that it's imperative that we as men, which age would you suggest that men start getting tested?
Honestly, at age 40. I would start testing at 40. If you show a family history of prostate disease, and this is one of those other things that people don't really realize, an unhealthy testosterone level increases your risk of prostate disease through its estrogen metabolism. So if you have a family history of prostate problems, 35, you should start checking your testosterone and estradiol levels.
Wow. Okay. Okay. Well, we're going to take another break, Doc, for the pay the bills, and we'll come back and we'll talk some more about low testosterone levels in men.